When somebody comes into the ER, somebody comes in the clinic, they're your neighbors, your friends, your church members, you know them. You know them on a personal level outside of work. And I think sometimes, there's some people that will say, well, everybody knows everybody. And there's good and there's bad to that. But truly, here, when people come in, they care. Because you are their neighbors, your friends, your co-workers.
Hi, I'm Tammy Dunker, and I'm the manager of Rangeley Family Medicine, and it's a pleasure for me to give you a tour today. So, welcome to Rangeley. So we have really tried to make our hospital a one-stop shop, and so you'll see we have the dental clinic on the left, and we have our admissions for outpatient services on the right. And our town didn't have a retail pharmacy, so when they built the new hospital, we included a retail pharmacy. And then this is our clinic. In our lobby, we have our children's area with our Reach Out and Read program and books and our check-in. This is our fun room. This is our pediatric room that we've worked really hard on. We invited our community and the kids in the community come and paint ceiling tiles with us so that they could be a part of their room, so they would have some buy-in on it. This is Jolene. Hi. And then all our provider offices are here and break room back there. This is our calendar where we track our visiting doctors and specialists that we have been able to recruit to come up here and help us out so our patients don't have to drive so far.
The community existed in a very small form for some years, but the oil discovery and the boom in the 1940s is really what built Rangeley into what it has. And it's remained fairly dependent on energy industry, oil, gas, and coal.
We may be the largest employer cumulatively, but the biggest economic base is oil and gas. I think the town has been founded and everything came to support oil and gas. Oil and gas supports the hospital with mostly, I think it's something like 93% of our tax base comes from oil and gas. So it's a big chunk.
The hard part about living here is that we are so connected to the oil and gas industry that business is directly related to how well it's doing in the oil field.
It's scary right now. A lot of people have had to move. The economy right now is really bad. We've had restaurants have to shut down, businesses shut down because there's just not enough people to keep them going, which is scary for us as a clinic also, because you have all your staff, and then if you don't have patients, you can't keep your doors open. The clinic is very important to this community. The hospital itself is very important. Without it, the oil field can't function, the coal mine can't function, the college, the local college here, the students, where would they go?
Healthcare access for Rangeley, if we did not have this facility, would be a drive of a minimum of 50 miles. And if you've got an acute condition or a traumatic injury, that's a lot of extra time. I mean, we talk in the wildland fire community about the golden hour of getting an injured person to a medical facility within an hour of occurrence, you would simply lose that entirely here if we did not have this facility.
Without us being here, you don't have EMS. You don't have an emergency room that we staff 24, even though there's only 3 to 4 patients a day in the ER, we get the same heart attack, strokes that everybody else gets. Major accidents, it's just in lower volume.
Well, I think it means everything. I mean, we have a community college that would not exist if we didn't have a hospital, and all the oil field jobs that we do have are dependent on the hospital for obvious reasons, emergencies and whatnot, and just care. So I think if we didn't have a hospital, and that was the other component, I think, of us getting one and people getting on board with it, we realized that if we didn't do something, because our hospital was so outdated, we wouldn't have a hospital, and then we wouldn't have a town.
The toughest challenges are probably regulatory cost right now. It's crippling to small hospitals. And if we wouldn't have had the voters vote for the new hospital, including the initial EMR, we wouldn't have been able to, I don't know where it would have come from, especially in a time when our town's been shrinking the last few years. Now, I know it's probably going to grow again at some point, but we're in the heart of pretty economic. I mean, there's a lot of worry around town when you talk to the businesses.
The other kind of fear out there is like, you know, we've been hearing a lot that it's going to be paid, they're going to start paying off the quality. And it's not that people don't give good quality, it's just if you have doctors who are picking their patients because they're worried about how much they're going to get reimbursed if they don't have healthy patients, I think we're setting ourselves up to have the sick get sicker, and those that can afford health care will stay healthy, and the ones that can't will just have to deal with what they're dealt. And I just don't think that's good health care.
I don't feel like we have the resources in the aspect of insurance and specialists. We don't have a lot of specialists here locally. Well, we don't have any specialists here locally, but closer to Grand Junction and everything, they're not taking our Medicaid patients for our county. And so whether we can provide fantastic care here, we don't have any specialists. And if you need to see a specialist, we're sending people to Denver and to Steamboat. And if you don't have the money for insurance, then you don't really have the money to transfer over there.
And Medicaid pays below cost on almost everything, even for the bigger cities that have more volume. For low volume places like us, Medicaid does not pay for cost. There's something that the healthcare provider fee, that's a big hot button topic right now. And that provides us almost as much money as our operating mill levy provides us. And HPF, you take that away, there's a good chance that I'm going to have to downsize to make it work. I don't even want to make it political. I don't want to make it Democrat, Republican, conservative, liberal. I'm just telling you what we need here to keep the services we have. The Medicaid expansion doesn't pay enough to really, it's hard in the bigger cities, but you make it up in volume. Here there's not the volume, and we have a big chunk now. I don't know what the expansion of Medicaid, how many it affected, but it affected quite a few in town. And that HPF helps make us whole.